Good morning, everyone. It is now 9 o'clock and we are going to get started. I first want to thank everyone for joining us today for our spring Medicaid fair covering the CMO updates. My name is Ebony Hill and I am your Gainwell Technologies provider representative for Territory 5. So before we get started, let's just go over a few housekeeping rules. All lines are muted upon entry. We will have a question and answer at the end of this session. So if you have any questions, please enter them in the question and answers box in the QA box on your screen, and we will address those at the end. If any questions are asked without that did not get addressed today, we will have all of those questions and answers posted to the GAMIS portal on April the 15th. Okay, so now that we've gotten those housekeeping rules out of the way, we're going to go ahead and get started. So I would like to introduce to you from the Department of Community Health, Ms. Catherine Ivy.
Good morning, everyone. I am going to start my video just during my introduction. We really welcome you to the Medicaid Fair this morning. This is one of the few ways we have to communicate with providers on a regular basis. So we use this to our advantage to provide information for you all that we feel is pertinent for the time, which we will do today. And then we also want to give you an opportunity to ask questions. This particular workshop is designed for any and all CMO questions. So I want to first let you know that there's a short presentation at my request from each of the CMOs. And my request was that they really focus on things that are particularly relevant right now as we wind down toward what may be the end of the public health emergency coming upon us, hopefully in a relatively short period of time. And I told the CMOs, because I always go in alphabetical order, so I always start with Amir Group, I was going to completely transpose it this time. And we'll start with Peach State Health Plan.
Catherine, thank you for that. Good morning. My name is Andre Greenwood. I'm the Vice President of Provider Performance at Peach State Health Plans. I bring you greetings from our plan president and CEO, Mr. Wade Rakes, and our COO, Mr. Ursel Fields. Next slide, please. Thank you. Peach State Health Plan has been operating in the state of Georgia since 2006. We are statewide and across all 6 regions in the state. We have over 668 local employees. Peach State Health Plan is owned by Centene Corporation. We have a little bit under 1 million Medicaid members across the nation. We operate in government programs in all 50 states, and out of those 50 states, we have 29 which are Medicaid. And we also operate in 3 international markets. Next slide, please. As Catherine announced earlier, it's key that we make sure that we keep all of our communication lines open. Here at Peach State, we have numerous email blasts that we send out to our providers using our web portal registration. We also communicate through our website postings, the What's New section, the annual provider newsletter, and our quarterly provider reports. Something that is key right now with Peach State, we are back in the field. We do operate with our quarterly and monthly JOCs on a virtual and also in an in-person level. And we are making sure that we are connecting with our providers and doing provider visits directly and also virtually. Another way to make sure to know who your provider relations rep is, we frequently update our provider relation territory list. On that territory list, you'll have the name of your provider relations rep, email address, and also phone number and cell phone number, with having entirely all access to contact your provider rep. In addition to that, as Vice President, my information is on there for any escalated matters or items that may occur. Next slide, please. At Peach State Health Plan and our members work with our customer service reps. They're able to update their demographic information by updating their mailing address, their telephone number, and also their email addresses. We update this information into our system, but we want to make our providers and the entire community aware that the 834 enrollment file is what is always going to supersede any updates that is given to our customer service reps. But we just wanted the provider community to understand that we do update all member information, but again, it has to tie with the 834 enrollment file. I want to say thank you to all the providers out there for the continued partnership with Peachtree Health Plan. We look forward to enhance our relationship, and thank you for caring for all of our members across the state. Thank you. That concludes the presentation for Peachtree this morning.
So now we'll hear from Caresource.
Hi, thank you. I am Becky Katzowitz. I'm the Senior Director of Network Performance and Engagement. And here with me is also Cheryl Ann Murray. She is the Director of Operations, VP of Operations. So we can go on to the next slide. So our mission at Caresource, being a nonprofit plan, is to make a difference in our members' lives by improving their health and well-being while focusing on the people and not the profits. So in order to do that, we focus very heavily on serving the low-income populations across the state with multiple products. And we're currently serving over 2.3 million members across Georgia, Arkansas, Kentucky, Ohio, Indiana, and West Virginia. We have been focused on a comprehensive member-centric model of care to address the entire population's social needs and helping our members navigate through daily lives and obstacles. We actually began in Georgia in July of 2017, so we are still young but growing in the Georgia market and doing everything that we can to help our members. So we can go on to the next slide. This year, our big focus has been transforming our provider experience. In previous years, we were trying to get our feet under us and focus on any claims issues that came up and being reactive in some ways, but really trying to focus on the member. This year, we are really focusing heavily on the provider experience as well. So we're using our opportunities with providers. We're getting back out into the state, getting back out into the practices so that we can focus on improving care for the members as well as improving the performance for our providers. Go on to the next slide. All right, and then to talk about Germany.
Good morning. I'm Cheryl Ann Murray, VP of Operations for Caresource of Georgia. Next slide, please. As part of our strategy to assist with the winding down of the PHE, we are starting the process of reminding members of the importance of updating their member addresses and phone numbers. And the different ways that we're doing that is we will be updating our IVR. So once a member calls in, there will be a reminder there saying, please remember to update your member address by either going to the Georgia Gateway, by calling 888 Georgia Enroll, or going to your local county DFACS office and making sure all of your information is up to date and accurate. We'll also do that at the end of each call when members call into our customer service center, as well as placing a reminder on the portal of the different ways that members can update their information. We will also be seeking assistance from the provider community by posting a message on the provider portal, asking providers to also please remind members of the importance for updating their member addresses and phone numbers, and our health partners will also be reminding during their visits to the providers as well. We'll also extend that process to our community engagement activities. So in an effort to please, continue to remind members of the importance of updating the information so they are able to receive all correspondences pertaining to redetermination and not lose any of their benefits. Thank you.
Thank you so much. Now we're going to hear from Amir Group.
Good morning and happy Thursday, everyone. My name is Vivian Scott, and I'm the Provider Experience Director at Amir Group. This morning, I'm presenting a brief overview of Amir Group and some of our activities. Also on the call with me today are representatives of the Amir Group Georgia leadership team that will be here to support answering any questions. Amir Group is honored and devoted to serve our communities, providers, and members of the Georgia Families and Georgia Families 360 program. And we've been a proud server of the Georgia Medicaid program since the CMO implementation. Our mission is to provide real solutions for our members who may need assistance by making the healthcare system work better and while keeping it more affordable for taxpayers. We proudly serve over 585,000 members today in both the Georgia Families and the Georgia Families 360 program. And we understand the needs of the Medicaid members and our key strengths tied directly to the goals of DCH for the Medicaid programs. Next slide, please. Thank you. Last year in May, Amir Group launched an Update Your Address campaign. The initiative included outreach to members using interactive voice response or IVR and text messaging, and we reached over 117,000 households, with around 14% of those members actually taking action to update addresses and/or correcting their zip codes. And we plan to run this campaign again next month, and we will also include the initiative at all Amir Group community events, making every effort to touch as many members as possible and to support having clean data on both addresses and other demographic information. The comment bubbles on this slide shows the link and phone numbers that members can use to make this update. And these are the parts of the information that we are providing, and so that members know exactly where to go to make these key changes. Next slide, please. Thank you. One of the most frequent questions we hear from providers is what are Amir Group's plan changes as it relates to telehealth? So we wanted to take a moment to communicate this. And at this time, Amir Group has no plan changes. So everything will remain the same, and you should continue to bill services using the appropriate CPT HCPCS codes, modifiers, and place of service codes. Here we've listed some of the accepted modifiers and place of service codes that are billed most frequently. And as many of you are likely aware, at the beginning of this year, CMS released an update to the description for place of service 2 and added a new place of service 10 code that now better distinguishes telehealth services provided in a patient's home versus a location other than the patient's home. And we just wanted to make sure we communicated to all on the call that Amir Group recognizes and accepts both of these place of service codes. Next slide. Thank you. So this is our last slide, and we wanted to provide key links and phone numbers to contact Amir Group. We included a link for new providers interested in contracting with us. And we also maintain a contact list of our network leads and associates for contracting, our national ancillary network team, and your provider experience team. We also included information for new providers interested in contracting with the Amir Group, and you can join our network. In addition to that, key information about how to contact or access our provider manuals, quick reference guides, and other materials such as newsletters and provider notifications that have been sent out to the network. This concludes our presentation today, and on behalf of my colleagues on the call and Mevin Lindsay, Amir Group Plan President, we want to thank you for your time and attention this morning, and we wish everyone a great rest of your day. Thank you.
Thank you so much to all of the CMOs for giving us some short presentations to start our talking points. So you could tell that the theme that we requested and they so kindly stuck to was information about how to reach their provider resource groups, provider reps, etc., and also information about our collective efforts toward rewinding from the public health emergency. I know you all know better than we do because your providers in our networks, in our various networks, that Medicaid members, like all of us, are pretty transient. We move around. Data shows us that Medicaid members are even more transient than non-Medicaid members in the general population. And so, you know, at times in the Gamma system, you will find that we don't have the correct address for the member. We may not even have the correct county that they live in. So we've asked the CMOs and everybody, and we're asking you to engage our member community in helping us be able to locate them. Because when we do need to renew Medicaid eligibility, send out applications, if we don't know how to find members, then we've lost that battle right out of the chute. So if you would just remind members and then transfer that information, you can tell that the CMOs are going to be fully engaged in that effort. We will be very appreciative. Now, I'm going to set some ground rules for the Q&As. The first ground rule is that any questions that are directed to a specific CMO, and I see one already in the Q&A, they will be sent to the specific CMO for response. You will, as a provider, receive that response directly from the CMO in a direct communication. We're gonna try to engage in just some general talk about CMOs without naming any particular CMOs, because that's just not relevant and not appropriate for this level of workshop. I'm going to start with the first one that Amir Group already mentioned, place of service 10 for telehealth. We've had a lot of questions about that. We know that place of service 10 is the newest addition in terms of indicating where the member is and whether or not the member received the service via telehealth. DCH is aligning our Gamma system as well to accept both place of service 10 and place of service 58. And don't ask me what 58 is, because I am not sure. But we understand CMS has opened that code as an acceptable place of service addition. So if you look it up and it is relevant to where you delivered the service, please use it. But just know that place of service 10 will be in the Gamma system, and then the CMOs will be fully aligned with the fee-for-service claim system in use of place of service 10. I'm going to address a couple of other generic questions that were really specific to DCH and not as specific to one particular CMO. And so I think it's helpful for me to just set the stage that way, and then I'll be reading out questions and we'll ask the CMOs in turn to address those questions. And I want to thank everybody for sending questions in advance, because that gives us a leg up and helps us develop some themes so that we can address questions sort of in a grouping rather than having to do them one by one. So first theme, are the CMOs required to follow Medicaid guidelines? The answer is complicated because Medicaid guidelines encompasses a wide range of things. CMOs are required in their contracts and through our arrangement, our approved state plan with CMS, they're required to deliver and provide all of the services through the CMO that are provided and included in the state plan, in the Medicaid state plan. So that's the baseline. They have to provide everything that state plan Medicaid allows and has approved through CMS. When it comes to rate setting, which was the next question that seemed to be a theme, when it comes to rate setting, our contracts with the CMOs do allow the CMOs to set rates dependent upon a number of things. It may depend upon the geographic location of the provider and the availability or non-availability of a particular provider specialty type in that geographic location. It may depend upon just the specialty availability, where there aren't very many, I'm going to make something up, gastroenterologists in South Georgia. That's completely made up. I have no idea how many there are. But if they're not very many, they may set a rate that's consistent and conducive to service delivery there so that they can fill their networks. When it comes to the rate setting, they also can provide higher rates than the state plan Medicaid that you'll find in policy manuals. So they have a lot of flexibility about that, and the flexibility is designed to work in everybody's favor. And so that was one of the questions that seemed to be relevant across the board and was a theme. There was one question about any new policies implemented from 2020 to 2022. And so what I'm going to ask the CMOs to do, well, let me focus on one other theme, because there are a couple of themes that I want each of the CMOs to really address. The next theme that I want them to address is credentialing versus contracting. So I'm going to set the stage for that one, and then we'll circle back around to new policies. As you know, the state Medicaid agency is responsible under CMS rules for the CVO process, for credentialing and validation and verification of licenses, et cetera. In that, our CVO process takes place minimum of every 3 years. That said, we've allowed quite a bit of latitude during the public health emergency. And so we just want to make sure that you all know to go back and check your CVO status to make absolutely sure that that you didn't miss an email, that you didn't miss a written correspondence from us because maybe your office moved. So please be sure and check that. We also want to differentiate the difference between the CVO process, which DCH does, and then the contracting process, which the CMOs are responsible for. We send the CMOs a large provider file of all providers in the state of Georgia, and that's sent on a routine basis at least a couple of times a month. The CMOs can tell me exactly how often, but it's a couple of times a month at a minimum. So they get all providers enrolled. They begin to create their networks around where they may have provider shortages, or they just may need more of a particular kind of provider because of the geography of that area. So let's start out. I want to ask all of the CMOs in turn if you can talk just a little bit about your contracting process, because there were a lot of questions about that. So we'll start again in reverse order with Peach State. And if you can just identify who is on the call from Peach State who can address that, Andre, that'd be great.
Good morning. I believe Dwayne Flowers is on the call.
Okay. Anitras, can you see Dwayne on the call and unmute him?
Yes, he is listed here as a co-host, which he can unmute himself. I just sent a request, so he should be good now.
Perfect. Wayne, can
you guys hear?
Yes.
Okay, good morning, everyone. Okay, can you restate the question one more time?
Yes. Would you explain or describe a little bit about the contracting process with Peach State that Peach State uses to contract with providers? How does it start? Are you proactively sending contracts to providers when you see that there might be a new one in a particular geographic area?
We do. We partner with a lot of the health systems because a lot of the independent providers are affiliated with a larger entity. In addition to that, if you're a new practitioner, recently licensed, and you're Medicaid enrolled, and if you like to participate with Peach State, you can access our public portal by going to pshpgeorgia.com, and you just click on for providers, and then become a provider. You simply fill out the provider contract request form. We receive it. We actually confirm that you're Medicaid enrolled, if you're Medicaid enrolled, and there's need, because we do look at accessibility, we do look at the specialty type, then we'll extend a contract. Now, if you're a part of a delegated group with a larger health system, and we approve the delegated credentialing portion, then simply you will get with your managed care department, and typically we receive monthly requests. They're usually ad deletion requests from the administrator of that health system. And typically, once we receive that request, we work it within 30 days and you're at it. We do, sometimes we have to check licensures, make sure all the information is valid from a delegated perspective, and then you'll receive your welcome letter. It's pretty much the enrollment process in a nutshell.
Thank you, Dwayne.
You're welcome.
Let's go then to Caresource.
Our policy is almost exactly the same as Dwayne's. We will check through delegation, we'll go through the 7400 file if needed, but we do offer the contracts in the exact same manner, so I won't say the same thing he did.
Thank you, Becky.
Thank you.
How about Amir Group? Do y'all do anything any differently?
Good morning. This is Monica Lester, Director of Network Management with Amir Group. We still have the slide up that gives the link. Joining our network is easy. That will take you to the web portal where you can submit your information for contracting. And yes, we do follow the similar process as the other two plans.
Thank you, ma'am. We appreciate it. Makes it easy. Now, I'm looking in the last thing that I want to ask you all about, and that's the CMOs, is we've had a lot of questions about policies, individual CMO policies. Can you, one by one, just tell us, tell the providers exactly where you post new policies? And let's start this time with Amir Group. How do you, Amir Group, communicate with providers? Is it through a proactive email process? Do you post things? Do you do both? That's really the nature of the question.
Good morning, Catherine. I was having a little bit of problems unmuting. Actually, we do both. We send out provider notifications via fax, and we will be soon including email communications. In addition to that, all those notifications are posted on our provider web portal under our landing page, news and announcements.
Perfect. That's easy enough. And Caresource, your turn.
So we do both as well. We send out our network notifications to all the providers, and we post the new policies in our tools and resource section of our website.
Thank you. How about Peach State?
Good morning. This is Jennifer Morris. I am the Provider Relations Trainer for Peach State. And we do several different things. So first and foremost, we send those out in an email blast to all the providers who are registered for the Secure Provider Portal. And we will also post those to our website. Any policies that change, we have a policy section on the non-secure site, on the public site, that providers have access to.
Thank you so much. I think that all of y'all have made it as easy and accessible as you can about policy. So I would ask all enrolled CMO providers to just pay regular attention to that. Just in case you don't get the pushed notification out to your office, might be a good idea to just check if something seems different, or check periodically. I'm going to return, since I've now turned into the MC, I'm going to return to lots of questions that we're getting in the Q&A box about the place of service codes. In GAMIS, we are not closing off place of service 2. We're just adding place of service 10 and place of service 58. So whichever one you use in Gammas is going to be acceptable. And we will understand that that code is out of office service delivery. And so I would imagine the CMOs are not closing off place of service to either, but I would just pay a lot of attention to the provider notifications on each of their websites to make absolutely sure. Because it's one of those things that we don't mandate across the board. And so just pay close attention when you're submitting bills for telehealth. Now, I'm going to take a couple of really quick and easy ones too. Will the slides be available after the presentation? Yes. As was announced early in the workshop, the slides are going to be up on the Gammas website. And I think, Anitris, within 2 weeks, they'll be up.
Yes, they're actually going to be up on April the 15th.
Excellent. Thank you.
Mm-hmm.
Okay. Now, there's a question about modifiers. While we all use fee-for-service, the CMOs use the same, I'm going to call them base procedure codes. We do not require that the CMOs use modifiers, or at least not the same modifiers. And so you may find at times that you are identified, for example, by your specialty code versus any particular modifier. So if you're a behavioral health provider, for example, you bill your claims based on the base procedure code and a modifier that indicates your specialty area of practice. Whether you're a physician or a psychologist or a clinical social worker or whatever that might be. The CMOs may not use those. And so I, again, would just pay attention to the modifiers that they do use. I'm going to open that up to each of the CMOs in turn. And I won't necessarily call on you, but if you have an easy way for providers to identify the modifiers that you use, please do speak up. I would imagine that those are easily found on the provider web portal, that providers can look up codes, see the associated modifiers with each of the CMOs. I don't mind being corrected if that's not the case.
Hi, Catherine. This is Vivian. For Amir Group, because modifiers can run the gamut and multiple modifiers can apply to codes, typically we will identify things through our provider notifications on specific services, but we do not have any type of a comprehensive list that shows all CPT codes and potential associated modifiers. We utilize industry standard billing practices. We do have a tool on our Ability portal that connects to Clear Claim Connection, where providers can enter CPT codes and modifier combinations to see if Amir Group recognizes those combinations.
Okay. All right. That seems easy enough. Anybody else want to weigh in on that question?
This is Shirley Ann Murray from Caresource, and it's similar for us. We follow the industry standards. If there are any type of unique situations or additional modifiers required, that information is shared through our network notification process.
Thank you, Shirley Ann.
Good morning, this is Amir McMichael with Peach State, and we follow CMS and DCH on our modifier process.
Thank you very much. That's really helpful, everybody. We appreciate it. We have a question that I'm not quite sure I understand. It's, and please, CMOs, if you do understand this, jump over me and speak up. The question is, why are primary payers not updated regularly and cause many denials because of it? I'm wondering if the question is related specifically to the primary payer being which CMO the member may be in. It may be, go ahead.
No, I was going to say, Catherine, or I think it may be a coordination of benefit questions, but it would be helpful if the submitter could clarify.
And you know, anything that we're not all clear about, if you want to clarify that, then we'll respond to it in the Q&As that will be posted. I think, Vivian, you're right. You may be talking about what we call third-party liability. It's private insurance policies, and you know, Medicaid is always the secondary insurer. So this is a question really not just to CMOs at all. It's a question across the board for Medicaid, because in fee-for-service, we also have a way in GAMIS for you to identify if we show that the member has a primary payer, which would be, you know, the parent's insurance through work or whatever that might be. And so I'd ask you to take a quick look in GAMIS, because whatever information we show in GAMIS, typically the CMOs have as well, though they do update those and then send us the updates so that we can align our two systems. And then for telehealth, once the public health emergency is ended, are there plans by the CMOs to reimburse for this service based on facility rates, or will it be subject to office rates? I think all of us, fee-for-service Medicaid, the department, CMOs are all trying to figure this out and align. The unwinding has us thinking about many things and how we want to unwind. And while a lot of decisions have not been made yet, just know that we're taking all comments and all requests into consideration. And so we're going to be thinking through these issues very carefully. And if there's anything that's different from the way that claims are being reimbursed now or at what rate, then just know that we'll post those as a provider message on the GAMIS website. And where it's relevant to CMOs, the CMOs will send those also as provider updates or provider messages. Let's see what else we have. Should providers begin using Place of Service 10 for all CMOs now? Amir Group says yes, they use and have coded Place of Service 10. I'll ask the other two if they know to answer that question.
For Caresource, we were waiting on official guidance for that, but I'll take that back and see if we can move forward with implementing or not.
Understand. Thank you.
This is Amir McMichael, and I would concur with that. I don't believe that we are currently not.
Okay. Just know that all of you on the call know that Place of Service 2 is not going away. And so each CMO, as they implement Place of Service 10, will push that message out to you. But otherwise, in terms of fee-for-service Medicaid, and I'm sure in the meantime, the CMOs that have not already implemented Place of Service 10, all of us will accept either one of those, or at least Place of Service 2, as we initially asked you to use in 2020. There's another question, let's see. There's a lot of questions about telehealth. So there's a really good question. How do we as providers update a patient's demographics to Medicaid and the CMOs? You really can't. I mean, you can send that message to the CMOs, but ultimately it's up to the member to update that. On the back of their Medicaid card and in all correspondence, there is a phone number that says it's the official DFACS change number. And if you could just remind the member that they need to call that, and indicate their change of address. Otherwise, I'm going to ask the CMOs to just review what they talked about in the beginning and what they showed providers about how to get that information to them, to the CMOs individually. Peach State, could you just review one more time how providers can submit that information directly? I think you actually had a website location that providers could send to. You may be working on getting off mute. I'll move to Caresource. Do y'all want to talk about how providers will get that information to you about a change of address?
Absolutely. We have a couple options. The first one is submitting it through the provider portal, and that will allow our team to update the address or any other information. The other is to work with your health partner, provider relations rep, to get the address updated.
Thank you, Becky.
My pleasure.
And Mirror Group?
Yes, similarly, Catherine, they can email their provider experience rep using the link that you see on the Contact Us slide, the NPS web at amiragroup.com, or they can call their local representative.
Thank you, Vivian.
And good morning. This is Andre. Providers could obviously use our provider web portal. They can click on the link that we have for our provider relation territory list, email or call directly to their provider relations rep in their particular territory or the direct key account provider rep.
Thank you very much. All right, we really appreciate all the participation in this, because we absolutely want to protect the members' Medicaid eligibility. So it's going to take all of us. It's going to be an all hands on deck venture to try and do that. We appreciate all the help and all the interest in that. So there was a question also about the change of status. And so they say that this provider says, many patients tell us they've called in and updated their information. They're told that they've been updated, but repeatedly the provider continues to get denials for patient. And this has to do with the primary insurance being another carrier. Both the CMOs and DCH contract to a company that does regular surveillance of insurance coverage and has contacts with hundreds of insurance companies across the country. And we do need the information sent to us so that that vendor, and I think we all may use the same one or close, most of us do, that vendor routinely updates information, insurance information. Where you will find often a lapse in that, and folks that we think have insurance but don't, or we think it's with one entity and it's with another, is often around that change of benefit time that people experience with their employers that occurs in December, January, and into February. So that's a time when we hope that we'll all be particularly attentive to the fact that members, children mostly, may be changing their primary insurance carrier during that time. And it's going to take a minute to verify all that, particularly during that high volume time when a lot of that goes on. And so we're just coming out of that period now. And so if you're still experiencing that, then please just keep at it and make sure that we know. That's the kind of information too that you can submit through the very contact us options through the CMOs directly, because they validate and verify member primary insurance information as well. So it can start there, or it can start directly with DCH, or more importantly with Gateway through the DFAC system. Either way, there is almost a no wrong portal for that information, but it may take us a minute to get that corrected in the system. And thank you again for that help as well. Let's see. Why do we have to complete separate CMO applications to credential therapists when we've checked the box to be a CMO provider in GAMIS? I wonder if you're talking about credentialing or contracting. Does one of the CMOs want to tackle that one?
This is Monica Lester with Amir Group. If it's specific to contracting, then a provider would be required to contact each plan individually to initiate the contracting process.
That's helpful. Thank you. Anybody else want to speak to that?
This is Dwayne with Peach State. If you're trying to participate in our network as a therapist and you're already through the CBO process, we do not require any additional credentialing. The only exception is maybe if you're affiliated with a larger health system, and if so, typically they have a delegated credentialing agreement with us, and so you will have to work with your managed care department.
Thank you.
And this is Becky from Caresource. We don't do separate credentialing from DCH, so you just have to contract with Caresource, but we do use the DCH credentialing.
Thank you, Becky. Thanks, everybody. That was really helpful. There's a really good question in the box that I'm just going to read out, and whichever CMO wants to take this first, please be my guest. What about adding a provider to a practice that's already contracted?
This is Amir from Peach State. I can start.
Okay.
If the provider is a direct provider, meaning we don't have a delegated agreement with that provider, we do an update from obviously the 7400 files. And to the point you made earlier, we are updating and reviewing the 7400 on a weekly basis. If we're dealing with a delegated team or group, then we receive updates, terms, and deletions, and new providers on a monthly basis. And that is where we would do the update, as Dwayne stated a minute ago, to get the provider into our network.
Thank you.
Hi, Catherine. This is Vivian at Amir Group.
Mhm.
Similarly for us, we manage adding providers who are joining existing TINs from the data file that we receive from the state. However, if for any reason there is a miss or there's fallout and the provider group, the existing group notices they do not see their provider in our network directory, they can contact their local provider service provider experience representative, and we will certainly assist to ensure that provider is added to their agreement.
Thank you.
And this is Becky from Caresource. For a new provider, you can contact your health partner, provider rep, and in the provider portal as well.
Thank you, ma'am. There's a good question that really looks like it could spur some thought on the part of the CMOs, and it is this person provides a statement that says one of the payers that they work with, doesn't say if it's a CMO or a private provider, whatever, private payer like Blue Cross Blue Shield or whatever, but says one of the payers that they work with has a monthly meeting that they offer all providers in the Georgia market. At this meeting, they provide updates on specific items that may be critical to the provider community. And the question suggests that all of the CMOs begin that same process, so that it's a good way to just verbally communicate and get Q&A directly. I don't know that we need any response to that, but I thought it was a good idea. Let's see. Told us at the last Medicaid fair that the CMO provider reps would respond to provider emails within 48 hours. This person asserts that's totally false. Let's see. This provider is still waiting for responses and wants to know what DCH can do to help help with that. So you all know that you can email DCH directly, and there are many people on this call that work in the managed care unit. I'd like for them to put their email addresses in the Q&A box. If you're having problems that you just can't get in touch with a CMO about, we're very, very happy to help with that. And then we just reach out to them directly and ask that they correspond with you. Let's see. One provider says they get claim denials for members that have primary insurance, and that the person actually doesn't, and the sites have not been updated. I think we addressed that one a little bit ago. And so sometimes Medicaid doesn't show a primary insurance, and the CMOs don't match the Medicaid website. That's because we are, as I mentioned before, we're all coordinating to try and figure out what primary insurance the Medicaid member has. And whether that comes in through a CMO or it comes in directly to DCH from the gateway system, from DFACS, it has to migrate into the Gamma system. But first, it has to be verified. We try our best not to make a mistake and send you to one vendor, one payer that isn't even associated or affiliated with the member anymore. So we validate those before we change the Gamma system. And as I mentioned earlier, it may take us a minute to validate those, because our vendors are reaching out across the country to insurance companies and to be honest with you, I don't know how they do that. They probably have a great big database somewhere, but it takes a minute to do that. And so we beg your forgiveness as we try to work through those things, and just give us time. But we do appreciate so much your helping us update and figure out what insurance the member is with. We're going to answer the question, where do we find in GAMIS if a consumer has primary insurance? We're going to answer that question. It's a good one to put on the web in the Q&A, so we'll do that. Who trumps the correct info, GAMIS or CMO? This provider saying often the CMOs have a different primary insurance policy than what GAMIS reflects. That may be because the information has come to the CMOs and they validated it, but GAMIS has not had time to reflect that validation. As always, though, if you take a screenshot of what you see in GAMIS at the time that you delivered the service, then that's your best recourse in terms of getting a claim paid. And so we really, and you do not have to print it out. You can do what I do every day of the week and take a screenshot in a moment in time, file it away in an electronic format, and that becomes your record of what you saw on that day that you delivered the service. Let's see. The CMOs will have an insurance listed as primary that's years old but expired. The information was never updated, and the claims get denied. Again, same issue. Just please make sure everybody knows. We'll validate that and update GAMIS. And those member files, by the way, from GAMIS are migrated over to the CMOs. And so there may be a time that you will find that the GAMIS system has not been updated yet, and the CMOs may have the most current information, and those two just need to become aligned. But taking a screenshot of the member file on that day that you delivered service is just a really good idea. And by the way, it's mentioned in Part 1 of the Medicaid policy. We're getting close to time. We've got about 5 minutes left, so I'm going to see if I see any themes real quick. Lot of questions about primary insurance. And all of these, we have a third-party liability unit in the DCH office. So these questions will be sent over to them so that they can address these and see if they can figure out some of these issues. Because obviously, there are a lot of you all having problems with primary insurance updates, and we apologize for that. We just need to let them know so that they can go back to our vendor and see if that can be corrected easily. Another provider endorses the idea of monthly CMO meetings for providers. So we'll give a shout out about that. Thank you. Let's see. And I think that's about the end of our questions. Just know that all these questions will be, unless they were to a specific CMO, if the question was directly about a particular CMO, what will happen is that we'll send that question to that particular CMO and ask them, because we know who you are. We got your name associated with your question. So we'll send your name and the question over to that CMO specifically so that the CMO can contact you and address your question directly. But obviously, if it was directed to a particular CMO, there's no reason for all of them to get it. So we've just got, I'm going to give you back about 4 minutes, and then we have a little bit before the next workshop starts. I want to thank all 3 of the CMOs for their really helpful presentation, for their responses to the questions today and in the future, because these will be posted and they will be influenced by responses from the CMOs. And then I want to thank everybody for joining us. We really appreciate it. I know it's less than ideal when it is when it's an electronic or a virtual meeting, but we really appreciate all your input. Thank you so much, everyone. Have a great morning.
Thank you.
Thank you.